this.
Buried in a wave of executive orders from the president is one that eliminates a program aimed at lowering prescription drug prices.
Only Congress can repeal parts of the Inflation Reduction Act that now lets Medicare negotiate drug prices. But as 10 Tampa Bay's Chris Hurst explains now, some are worried cuts could come that hurt seniors and people with disabilities.
And she says, I'm 77, have been disabled for over 45 years.
Karen Clay's job as a healthcare advocate
I live on Social Security, Medicare, Part Medicaid.
is to gather stories from seniors.
If there were any cuts, plain and simple, I could not survive.
She's on Medicare and is concerned after one of President Trump's first actions was to rescind a Biden executive order that sought to cap some generic drug prices at $2 a month.
There are certain breathing medications that my doctor prescribed, but I couldn't afford to pick them up.
The president included the order along with dozens more, saying it's the first of many steps the United States federal government will take to repair our institutions and our economy. The action won't directly impact current drug prices.
We talk about health care reforms. We talk about welfare reforms.
But it could be a signal that other Biden-era health care expansions could be cut. Leaders in Congress have discussed cuts to Medicaid disability waivers and ending subsidies for insurance purchased through the federal marketplace.
To rein in this out-of-control spending, especially the mandatory spending that's driving the debt, to restore fiscal responsibility.
The shift in tone has Clay thinking action will soon follow.
We have to just keep talking to our legislators.
One she says she'll keep fighting by sharing stories of those who need the help.
We've got to get individuals to share their stories, and we just have to fight.
In Tampa, Chris Hurst, 10 Tampa Bay.
And as it stands right now, many seniors on Medicare should see savings this year on prescription drugs. Out-of-pocket spending for drugs is capped at $2,000 a year now for Part D enrollees. And there's currently no change to the $35 a month cap on insulin.